So, dear colleagues, my name is Martin Reck. I'm a thoracic oncologist and I'm working in Grosshansdorf, which is in the north of Germany. And I'm pleased to talk about our recent report about the IMpower133 and IMbrella A trial, describing the long-term outcomes for patients with metastatic small cell lung cancer. Well, you know that small cell lung cancer, in particular metastatic small cell lung cancer, is a very difficult disease, and for decades we haven't made any progress in treatment of these patients. We have seen a shift of the paradigm with the introduction of checkpoint inhibitors in combination with chemotherapy, and the IMpower133 trial has been one of the first trials supporting this new standard of care that we do have for our patients with metastatic small cell lung cancer. So in the IMpower133 trial, patients with metastatic small cell lung cancer were randomized either to a conventional chemotherapy with carboplatin and etoposide or to a new schedule, which was the combination of chemotherapy with atezolizumab and anti-PD-L1 antibody. The primary endpoint of the trial was overall survival, and we have seen a significant improvement in overall survival and progression-free survival in favor of the combination of chemotherapy with atezolizumab. So this is the new standard of care which we can offer to our patient. The big question in small cell lung cancer is the question about the durable responses. We do see a fast relapse in the majority of patients, and we are really aiming for getting a durable control of the disease by our systemic therapy. So in the IMpower133, there was the opportunity after the official follow-up to roll over patient to an observational trial, which was the IMbrella A trial. And in the IMbrella A trial, patients were monitored for overall survival and safety. And out of the patients who were treated in the IMpower133 trial and who were at the end of the follow-up period, there was the opportunity to roll over to the IMbrella A trial as an observational trial. And we had, out of 26 possible patients, 18 patients to come to the IMbrella A trial. And there were still a couple of patients on treatment with atezolizumab. And for the IMbrella A trial, we had now the survival data, and we had the privilege to publish these survival data. And we do see 3, 4, and 5-year survival data in the range of 16%, 13%, and 12% 5-year survival. And this is somewhat a very good message. This is somewhat extraordinary because in particular, in small cell lung cancer, we haven't seen any 5-year overall survival before. So this is really good news for the patient that at least in some of these patients, we are able to achieve a very durable response by the implementation of checkpoint inhibitors like atezolizumab in the systemic therapy. And I think the other important message coming out of this analysis is the message that out of the 18 patients who rolled over to the IMbrella A trial, still 11 patients were under treatment with atezolizumab at the time of this analysis. So we do see that indeed there is a portion of patients with a very long benefit from the combination of chemotherapy and immunotherapy. But of course, we also would like to know, how can we identify these patients? This is the question of biomarkers. And we also performed some genomic analysis on the tumor material. The problem is that the patient numbers are very, very small. So we only have some exploratory signals that potentially some genomic signatures are associated with a better outcome following the combination of chemotherapy and immunotherapy. But this is something that we really need to follow up with larger patient numbers in prospective trials. In terms of safety, nothing new appeared. We had some safety events like GI toxicities. There was one pneumonia which happened during the treatment, but there was no really new safety signal in this follow-up period. So as a summary, I would like to say, well, we have made a next step in the management of metastatic small cell lung cancer. We do see an impact on overall survival by the addition of immunotherapy to chemotherapy, but now we also can say that we do see progress in the rate of long-term survival in patients with metastatic small cell lung cancer, and I think this is quite an encouraging message.